what Bristol Myers Squibb has done is to, considering what the new actions with the Affordable Care Act recently, the challenge is with accessing the information, going through the plan, selecting a plan, and deciding on what can actually be paid. Bristol Myers Squibb created the Healthcare Assist program. Now, the program takes into consideration to avoid any disruptions in medical care or in medications. Now, what the program does is a caller calls in, and there's trained operators that specialize in each state. As you know, not every state actually expanded. And what they would do is take the information of the caller, review the plans that best fit that individual's needs without the caller having to navigate the entire website. It will then go step by step what actions to take once that caller goes on site, then provide a summary of what was actually discussed, either in the mail or email, whatever venue is best, and then follow up after January to see if that caller actually did apply or if there is any additional information. So it's just one of the resources, one of the many resources that Bristol Myers Squibb has to educate clients. And in this situation, considering that the Affordable Care Act is hot at this moment, this is a service that all of your clients or yourselves can actually benefit from.
And people are. That's why people pass around a plate to collect money during a service. The money situation with regard to HIV and AIDS, and particularly the program that I work with, which is Bright and White funded programs, is not good. We just suffered an $18 million loss in our grant award this year. So what does that mean? That means 90 different organizations in the city that received Bright and White funding got cut. They cut 5, 8, 10% of the dollars that came into those organizations. Over 118 people in those organizations were laid off. One day, someone walks into an agency to see their case manager, they're gone. We heard from a planning council member that he went in to see his doctor, gone. His doctor had 1,500 patients. Food services are being cut back. There's no dinner at GMHC on Christmas. Legal aids, gone. So the effect of the sequestration in Washington, which is a onerous imposition on federally funded programs, is feeling its full effect in New York. It's feeling its full effect here in the health department and in all the programs that we fund. In total, we lost 14.5% of our award last year. It was the largest amount of money we've ever lost. It sent us into a deep pit of despair. But the council pulled together and they figured out how to take the cuts. The cuts then went to the organizations, and the organizations then either laid off staff, they cut back on their hours, they furloughed people, they discontinued Saturday service, they told you might have to wait a little bit longer to see your doctor, they may provide you with less services. That's how they're dealing with receiving less money.
You know, for me, when I kind of go back and forth about resources. Resources are tight, but there was a time when we used to talk about how important it's going to be today when we get to this point where we have less money. I don't like why we have less money, but I think we tend to focus on a lot of negativity and not on what we're doing well. And one of the things we're doing well is reducing HIV rates, not in every community, but we are across the board. I was glad Jan went before me. I actually asked that he speak before me because I'm on the planning council. I happen to be the co-chair of the committee that's dealing with this big issue. And while Jan and I don't always agree, which is very healthy, good way to work, this is a very informative person that brings us information quickly, and I don't know how he retains all of it, but this is what it's about today. When you think about resources, how do we work together, community people with folks from the city and state, going out there figuring out how to address this issue. But I want to go to where the Reverend, I believe, started, talking about small agencies closing. This is a reality of today. I hope people don't get upset at me, but this is just who I am. It's a reality of today. We've never heard this level of talk about heavier collaboration, merging organizations. Some of them, a lot of us don't agree with because the merger seems like a takeover. Glad it didn't work out. Did I say that out loud? I did. I did. Myron, did I say that out loud? Sorry. So, but some mergers, especially now, are very necessary. I remember when we first started talking about faith-based organizations getting involved, and there was this beautiful attempt, and Jan and I happened to be on the prevention planning group then, and so oftentimes people run out and do something, and that was handled poorly. So they got some money and gave it to these faith-based organizations, and little was done with that. So, we are at a place now where some smaller folks and some smaller organizations are going to have a very difficult time right now. This is the time when we're going almost back to the early 90s when the small organizations were going to the large organizations, or organizations who've had some time, who've been doing this a while, who have experience, and say, can you partner with us? Can you help us get there? It's a little surprising for me. When I first started doing this work, and I was very young, and I had hair when I started doing it. And I used to be cute. Dreddy, I used to be cute, Dreddy, a long time ago. But I'll tell you this, in 1985, while in the penitentiary, not in the correctional, what do they call them, correctional facility, because they didn't correct anything, but the actual penitentiary is where in 1985, when I first started doing HIV and AIDS work, and I really believed when I came out and found a job, which I was surprised, but I was happy that this one organization started to address this issue. I really believed I wouldn't do this work for maybe a few years. I did. I thought it was such a crazy, outrageous disease, and watching people, it just couldn't last this long. It just wasn't supposed to. It didn't make sense. But we talked back then, and folks from ACT UP and people, we talked about not necessarily being here, but being at a place where we're heading in the other direction. So I tend to look at some of these resources or lack of resources as us, again, not the way they come, because there's money out there and it's not coming appropriately, but in some ways, the folks who need the service, like before, those numbers are not the same. But I think what happened, I think what Jan spoke about also is these services, the specific services that end up being cut. It is a very difficult position for us to be in on the Planning Council, to look across and go, this is our biggest problem. How do we take an $18 million cut?
So in the situation when we're talking about finances, I don't see it totally hopeless. I can see definitely some innovative things coming out of it. And probably that's what we definitely need to go back to, is the innovation of HIV, because I think when we're looking at the numbers continuously rise, we have to agree that something's not working. There's something that is a disconnect somewhere where the numbers are continuously rising, and it's broken somewhere. And by continuously throwing money at it, that doesn't necessarily mean the problem is going to be solved. We need to see what's working and definitely build on that, and what's not working, and say, okay, let's move on, because it's no longer being effective.